Welcome to Clicks and Bricks Podcast. We talk about the entrepreneur mindset.
If you get one shot at this, what kind of shot are you going to take?
If we forget who we are, they're going to forget who you are.
You've got an adversity story that's out of this world.
Everything from that Main Street brick and mortar to that billion-dollar manufacturer.
Welcome back to Clicks and Bricks. Today I'm talking with Donovan from Ethos Benefits. How are you doing today, Donovan?
Great, Ken. Thanks for having me on, man.
Thank you for joining me. The audience doesn't know this, but this is our second attempt. You had a Roomba try to eat all of your Ethernet cables on our last run. I'm glad that we got this rescheduled pretty quickly. Before we jump into the interview, Donovan, can you tell us a little bit about who you are and what possessed you to start Ethos Benefits?
Yeah, sure. Donovan Ryckis, personally, first-time father. I have a newborn son right now at 40 years old. I took my time. So that's what's exciting in my personal life. In my professional life, I am the CEO of Ethos Benefits, where we do healthcare consulting for large to enterprise businesses. So typically in the range of 200 employees all the way up to like 10,000-ish. And I kind of got there by accident. You know, I started in financial services, which is a pretty broad sector. I'd say that could be anything from selling life insurance to getting to securities, which is kind of the path I took. I was a securities advisor, so kind of a financial advisor, if you will. And back when I was doing that, my kind of ideal client persona was a business owner. So I was working with business owners on both their personal wealth and then kind of got into and pension planning in their companies as well. Super happy doing that. Loved it. Kind of felt like I'd hit the pinnacle in my industry as far as knowledge and professionalism and perhaps, you know, revenue as well, kind of doing that until one day I kind of got introduced to one of my clients' healthcare problem. And I really realized while I was working with my ideal client, I was nowhere near to solving their biggest problem, which was the healthcare spend. So more of the employees' dollars are going to healthcare than their 401k. So healthcare in this country is literally robbing the future of American workers because they're not even able to contribute. So I saw that on their side. I saw it on the employer side as well. It's typically expense number 2 in just about any business, and really realized that the work I was doing was going to be much better served in the healthcare side in bringing a fiduciary approach over to healthcare where that does not exist. That's a standard in financial services. And we can kind of talk about that, but it doesn't exist in healthcare. So that's kind of where I went.
Okay. I'm just kind of thinking here. I know that for me personally, medical insurance is my largest personal bill, hands down. And for the company, medium-sized company, I think it's probably our 4th expense. Power and electricity and payroll are our high ones, but then it comes in medical. Mm-hmm. And for my really small, like my gym, like my micro company, right, under $1 million revenue, it's a very small. We only have one full-time employee, so it's very good there. So Absolutely, it's a big deal, right? And so a CFO can go with you and potentially lower their medical spend, right? Is that what we're looking at?
Yeah, big time. I mean, there's a lot of things that kind of create the conflicts, and part of it is that fiduciary conversation I address. So like, you know, when you're a business owner or an executive at a business, you know, most of the people you hire, you know, they're working in your best interest, whether we're talking about an attorney or a CPA or, you know, the financial advisor that's setting up the 401k for your company. Nowadays, those people even are fiduciaries. So they're acting in your best interest. They're being 100% transparent with the transactions and also with their compensation. So there's no misaligned incentives in how they're getting paid to work for you either. So that exists in most everything else a business owner does. But in healthcare, it is the wild, wild west. The standard of care for an employee benefits broker is a suitable recommendation, not one that's in their best interest, not one that, incentivizes me more than them, right? And a suitable recommendation is literally anything that's licensed to be sold in the state. That is suitable to sell, suitable to offer them. And there's little to nothing as far as, you know, conveying the conflicts of interest and compensation and how decisions are made, all that kind of stuff. So you really have this kind of misalignment with huge expense, little to no information, no standard of care on getting the advice or processes, data and transparency, all that kind of stuff. It's crazy.
It is wild. My tip for the listeners here, if a vendor or sales rep won't tell you how they get paid, you are the product. And I'd much rather be the client than the product, is my personal opinion. How much, like, I've got a whole bunch of assumptions, and the medical insurance in general is not my jam. It's not my favorite thing. Brokers hate me. I'm a bit of a jerk. It's not been there when I needed it before. And I call that crap out when I'm in these meetings. So what are some ways other than just moving from United to another provider, right? What are some ways other than just jumping ship and price battling vendor to vendor?
Yeah, 100%. And Ken, I'm with you. I literally started Ethos because I hate health insurance too. I'm like, this is ridiculous. The rules are ridiculous. Nobody understands it. It only goes up. Like every time it changes, it's worse. And that's why I started. So I say it all the time. Like I literally hate it, but it's not that I hate what I do. It's I hate the experience that people have been given, and there's another way. So when we're talking about the typical experience, and part of this all comes like, there's a great quote. I think it was Warren Buffett said, "Show me the incentives and I'll show you the results." Right. And that's where this whole thing really gets off track. Is the health insurance is one of the only things where the client, the employer or plan sponsor, is hiring the broker, but they're not the ones incentivizing them. And that's where the whole thing starts to get off the tracks. Right. So that's really the biggest thing. So what employers have been used to is brokers, and what they're doing is they're brokering a risk transfer. So a sale of insurance transferring the risk to United, to Blue Cross, to Cigna, to Aetna, right? And the problem with that is that employer truly isn't the one paying or incentivizing the broker. And that's where you get into just carrier switching back and forth. They're just trying to sell a new risk transfer, Blue Cross to United, to Cigna, to Aetna. Instead, if we're looking at risk and like how we would deal with risk and higher premiums, right? There's basically only 4 things we can do with risk in any category. We can reduce risk, we can avoid it, we can retain it, or we can transfer it. And the problem with brokers is they only look at transfer. So the first 2 strategies, reducing risk and avoiding risk, there's no mode of compensation for a broker to even do those things. They only get paid on the transfer, which is why we're only ever interested in carrier switching. So what we do is we get a lot more granular. We're not focused on the premium. We're focused on all the dollars coming out of the healthcare plan. I think everybody in the country knows hospital prices are wildly variable and imaginary, maybe, how these premiums come up. I think a lot of Americans have heard of now about pharmacy benefit managers and the conflicts and the pricing they're kind of taking out in the middle. So it's really just focusing on the actual expenses within the healthcare plan to fix the premium situation. So we're reducing risk by reducing those costs. And we're seeing what parts of the risk we can just avoid. And then we're getting to the transfer. And that really starts to change how we're evaluating the whole problem.
I'm also not a fan of the pharmaceutical companies, the big pharma.
Yeah.
But I'm going to give a shout out because you said it. Our boy Mark Cuban with Cost Plus Drugs is changing the game, right?
Yep.
And cutting out all the middlemen from what it seems. And I absolutely love following that. I got caught up in that EpiPen debacle a few years ago. I also had the situation where my high deductible insurance was canceled after Obamacare because it was no longer covered and I had liver disease, and they were able to just disqualify me for pre-existings. All the lies that we were told didn't actually happen, right? I had a plan that I loved and I had to leave it, or they were able to kick me off of it. So other than just jumping from one plan to the next, if I'm a CFO and I'm locked in for a year and I'm 6 months in, is there something I can do right now, or do I have to wait the 6 months?
So they typically go on like 12-month cycles, but yeah, you can do something whenever you want. So the question is really like when we're looking at this at renewal time, which is, whatever 12-month cycle any company's on, they're all different. But the question is like when we're evaluating solutions for the upcoming year, The only question they should be asking is like, okay, how is this actually going to reduce the frequency and severity of claims? Which a claim, reducing the severity of a claim is a dollar amount. We're not magically trying to say their people should get healthier or they should not be sick. We hope that happens, but that's obviously not something the employer can control. So because of that kind of thought process, brokers have always just kind of said the claims are the claims, meaning like whatever, like we can't do anything. I'm sorry, your employee was sick and that happened or whatnot. But again, the focus should be on how can we reduce the price of those claims? Because a claim is just a request for dollars. So what they're talking about is the condition, like the medical condition that occurred is the condition. But claims are wildly variable. Those we can really, really affect. So you talked about like Mark Cuban cost plus drugs. There's all kinds of other mail order pharmacies that we utilize in our healthcare plans with our clients. So we'll source drugs from Canada. So the employees have an option to do that. When we do that, the cost of the drug for the healthcare plan is anywhere from 50 to 70% less for the health insurance plan. And if the employee opts to do that, if they opt to mail order the drug from Canada, they get it at no cost. So if they want, they can go to Walmart and get it for $75 copay, $150 copay, whatever it might be. It's usually the very high cost drugs. Or they could say, yeah, I'll sign up for mail order, get it to my house every day, right? So solutions like that you can implement into a healthcare plan that actually are shown to reduce costs rather than just signing up with an X carrier. Because if you were with one of those carriers that you mentioned and you said, hey, I know of this mail order pharmacy program, I did a pricing study of our top 10 drugs, we could save $250,000 on the same exact drugs. Can I do this? So I'm going to give it to them. They're going to say, no, thanks. You can't do that. You cannot reduce your costs. Sorry, because that's part of their profit. That's part of their PBM profit.
Right.
So it's all about putting real strategies in front of employees. And that if it helps the employee, it'll then help the plan and the company.
Right. Because if the employee is spending less on drugs this year, it doesn't help my premium this year, but it will help my premium next year.
Yeah,
right?
absolutely.
Because this is an ongoing thing. So is that education through the HR department to the staff, or how do we get a staff? I've been charged with changing culture in a company a couple times in my life, and it's one of the more challenging things to do outside of marriage and children. How do you get a company from the HR department to change, swinging by I know getting my wife to change a pharmacy because she likes to swing by the drive-through real quick is next to impossible. So how do you get that with a company of 200 to 500 people?
Yeah. So a lot of it takes time, right? So sometimes it takes a year or two to get the employees slowly on board. And then as some employees hear of success, they start to buy onto those programs. So a lot of it's just proactive and explaining to them like, hey, for the first time, like we're not changing insurance because this is going to get worse. And we're not increasing your deductible. We're not doing all those things. But also for a lot of these programs, like we're installing them within the healthcare plan. So basically what happens really, because not all drugs you can source from Canada, it's usually the very expensive ones. So if a member were to go fill that drug, right, and they go to, Walmart or wherever they go, Walgreens, CVS, they would just go ahead and get that drug and we would get notified on the back end. And then we would just start sending them notices like, hey, would you like to mail order this at no cost? Right. So a lot of it's very targeted outreach, but then we also do general communications. We're kind of explaining these things because we do the same thing with generic drugs. And that's, something we're a little bit more proactive about, just pushing out to everybody. Because same thing, if they want to sign up for mail order pharmacy there, kind of similar to Cost Plus, right? Same idea. They can get them to their house, zero copay, right? So some of it's general communication, some of it's targeted communication. The thing about healthcare plans and how they actually operate, once you start getting into the back end and the finances and the claims data, it's way worse than like an 80-20, where, like 20% of the people or 80% of the claims. It's more like a 5% of people making up 75% of the claims. So the goal and the problem is not to like handcuff everybody, make everything hard for everybody. What we really have to do is when we see those triggered claims, help those people out, get them sourcing their drugs. Same thing with hospital claims, right? Like giving them the resources and the ability to, get a second opinion. Like we have plans where we have centers of excellence networks where you could say, hey, this person just had a cancer diagnosis. Would you like a second opinion at the Mayo Clinic? Right. And these are things we offer them at no cost, no copay, no deductible, no nothing. Would you like to go here? Would you like to go there? This is a cancer only clinic and they have 100 locations in the state. Right. And when we do that, they get better outcomes. We get better pricing because, as you might imagine, a cancer only, like a specific cancer only clinic versus your neighborhood big box hospital that's doing, everything from pregnancy to knee surgeries to cancer, right? Not only do they not have as much practice in treating one particular condition, but they also don't bill it efficiently. We'll pay more at the place that does it less and has worse outcomes.
They have
So
no
it's
economy of
just a
scale.
little bit, yeah. So it's when you really dig into it, it is the things that make perfect sense that you can finally just implement, and the employees are happier, they're paying less, and the plan's paying less. And it kind of breaks CFOs' brains because like the way it's been done is like anytime the company wants to pay less, they have to shift more to the employees. And that's just fundamentally not what we need to do. Once we kind of start looking at it a little bit differently and saying, let's control the supply chain, right? There's on average about 18 claims per insured employee per year.
Wow.
That's a ton of invoices, right? And you might say that sounds really high, right? Like I'm sure every employee isn't doing that. No, but some have their spouse on and their 2 kids, right? And one claim might be one prescription once a month, right? That's 12 claims, right?
Okay.
So when we think
you've
of
got-
like,
my house is a bunch.
yeah, yeah. So, I mean, think of just 18 claims per insured employee. Who's got their eye on that? Not the health insurance company. They make more money when you spend more
Well, they
money.
got their eye on
Pharmacy
it, but
makes,
they're not going to say anything.
no, nobody in the supply chain is incentivized to reduce costs for you, right? And a really awesome concept I heard that kind of like breaks this down simply when you think of it is the purpose of a system is what it does. So you can't say that the purpose of a system is something that it repeatedly fails to do. Therefore, we can't say health insurance is designed to keep costs down because it has failed to do that over the past 20 years, utterly, all of them, without doubt, without question. Nobody would agree to that statement.
Health insurance,
It's
in my
either,
opinion, yeah, it's
yeah,
crazy.
it's just not the purpose, right? That is not the purpose of health insurance.
I
That is
think
not what it
I'd love to talk about the history of health insurance for a minute because I think originally it was just hedge your bet. I'm going to bet that I'm going to get
Yeah.
sick. You're going to bet that I'm not, and we're going to play that little game. That was originally 40, 50 years ago how insurance
Yeah.
was. We didn't have medical insurance when I was growing up. We went to the free clinic for stuff.
No, and part of it is like the medical inflation, and it's not actual inflation, like it's medical inflation. And then another part of it is we're the only country in the world that has pharmacy benefit managers. We pay more for drugs than any country in the world, even though we developed most of these drugs. It's crazy. It's crazy.
Yeah, I'm a huge fan of capitalism. I love it. I think it's gotten us to where we are today. I don't think it has a place in medicine or food any longer. I think we have to start changing some of our systems. Donovan, what does PEPM stand for?
So PEPM is just per employee per month.
Okay.
So it's a kind of a metric we use if we're either looking at claims costs or just general benchmarking, because typically the problem with any employer is they have no metrics for their healthcare plan. Like they couldn't tell you what their past 5-year trend was. They couldn't project their costs forward 5 years to try and, budget that in. So first thing we're doing with any company really is seeing where they've been, defining how bad the problem is, comparing that to benchmarks in their state, in their industry, for their competitors, right? And then just seeing how quickly do we need to solve this problem. Like every company has a healthcare problem. We just need to define how bad is it and how quickly do we need to fix it.
All right. So beyond PEPM and renewal percentage, which KPIs, key performance indicators, actually prove the plan is getting healthier and cheaper over time?
So certainly drug costs are a really easy one, right? Because drug costs are wildly variable and we can, we know that there's a national drug code for every prescription. And then we can easily see like, what are you paying versus another company? And what we're starting to see, and I mean, I've always known this, but now the public's starting to see this is not what people believe, which is big company, better pricing, small company, worse pricing. That is fundamentally not how it works. And we're starting to see that with healthcare lawsuits coming out, much like 401k lawsuits have for the past 20 years. Johnson & Johnson was the first. Since then, JP Morgan, Wells Fargo, we're starting to see a lot more of these. The cost for basically employee versus employer for the cost of drugs within their healthcare plan. And the short of it is, after I went through the lawsuit, I pulled out the 35 cited drugs in there, ran it against my clients. My clients were paying 93% less for those same drugs. So that's how wildly variable. We're talking about a Fortune 50 company versus my smallest client being under 200 employees. And the under 200 is paying 93% less for the same 35 drugs that they had in the lawsuit. Like it's fundamentally not a big versus small thing. It is metric tracking, right? So to your point, tracking the cost of drugs against the cash price and finding out who has interest in that supply chain.
Okay. So really looking at the margins of the cost of the drugs is a huge savings.
Yeah.
I think you just
the
answered
cost
my
of
next
drugs.
question on accident. But
Yeah, same thing with any type of hospital claim. So I mean, the responsible way to look at hospital claims, since pricing can be so wildly variable, is finding a reference point. And the reference point that we most often use is Medicare. As the largest insurer in the country, Medicare has an agreed to amount price for any procedure that could be done in a facility, right? So we look at what every hospital has agreed to take for Medicare for anything from a Kleenex to open heart surgery. And then we price that up for our employer sponsored healthcare plans, instead of letting them come up with this price way up here. And they say, oh, but you get that 30%, 40% PPO discount, but we're still 10 times the Medicare price, right? So that's another KPI we like to track, and those can get wild. And the crazy thing about billing practices when we're talking about healthcare is like a lot of companies would change a vendor for 10% pricing, 20% pricing, 10% lower cost, 20% lower cost. When we're talking about hospital claims, it's not percentages, it's multiples, 5 times, 8 times, 10 times, 18 times higher than Medicare. And those are the numbers that very few companies look at, to point like even J&J, right? Like those are the numbers we need to look at, because it's going to be the 5% or less of the population and the price you agreed to pay on those procedures. That's going to change the cost of your healthcare at the end of the year.
Trust with employees is everything. What transparency tools and data security guardrails do you insist on to keep the plan credible?
I mean, transparency, a lot of it is helping them. I mean, you're kind of dealing with two ecosystems. One is healthcare finance and one is healthcare delivery, and both of them are confusing, right? So a lot of it really is more so on helping them on the healthcare delivery side, because on their side, it's pretty transparent what they'll pay, right? They have their summary of benefits, but where we can really help is help them navigate, whether that's, their doctor who's owned by the hospital system told them to get an MRI. Therefore, they told them to go to the hospital to get the MRI. And that's for $4,500, right? And instead, we are able to help navigate them to an outpatient imaging facility for $450, right? So a lot of it is more so on communication, on healthcare navigation, which inevitably brings in the healthcare finance side, right? So when they engage with their healthcare plan in a proactive and helpful way, if they would have went to the hospital, they might have a 10% co-insurance to pay on that, right? So they might pay $450 for that $4,500 MRI. If they call and engage with the healthcare plan on our direct contracts for advanced imaging, we would actually set the appointment, give them a voucher that it's paid for, and they would have a $0 copay. And also they don't have to go into the hospital. So that's kind of where the trust and engagement is. And then they in turn get to also benefit and they get rewards from the healthcare plan instead of it being the opposite kind of experience.
Awesome. On scaling Ethos, you've had to automate versus delegate across underwriting, claims, audits, vendor management, and employer reporting. How do you know which ones to automate versus which ones to delegate?
I mean, I think we automate a lot of things and just kind of pull our red flags and our triggers so we know what's going on. Our job is to kind of get into the data to a degree that a lot of employers have never really seen or experienced. So they're not necessarily going to know what they're looking for. So we're kind of pulling those triggers and automating the reporting for them to look at and learn along the way. So typically it's something where we're slowly training their staff over a couple of years. So internally, we do a lot of automating. We don't delegate much to them in those regards. That's going to be really more communication, right? Where they're communicating to their people.
One of the core values in every single company that I ever start is if it can be automated, it will be automated. Like just automate everything as much as possible, monitor it, measure it, track it, alert when the automation breaks. But if
100%.
you don't, your
I think
competitor
too,
will.
one of the things that we've been able to do that's been helpful is like we'll automate like our ticketing systems that actually allow our clients to see everything that we're working on. So it's like a no action kind of thing. Like they don't need to do anything, but they get a weekly report of here's all your employees that called us and here's the things we're working on for them. And they can look at it, they can delete it, whatever. But it's the automation and the transparency. And that keeps my people accountable too, right? Because they know these reports are going out on Thursday or Friday, depending on the client. And then that kind of automation just keeps everything moving smoothly.
Donovan, you co-produced a project to reframe how employers buy healthcare. What behavior changes are you trying to spark, and how will you measure that impact?
Yeah, so the project is a documentary. It's called It's Not Personal, It's Just Healthcare. And it goes through all the issues of the healthcare supply chain when we're talking about employer-sponsored plans, which covers 183 million Americans. The goal really is to shift the whole industry. I mean, starting with my side of it, which is like the benefits brokers that get paid commission, percentage of premium, bonuses from the carriers, all the way to the human resources department and how they ask questions and how they vet these decisions for these people. You know, when I talked about, my clients at 200 employees getting better results than 150,000 employees at Johnson & Johnson, that is ultimately just down to the decision the human resources person made. And they just made a better decision because they had better questions to ask. So that's really the main goal of the project, is to equip CEOs, CFOs, human resources, presidents of operations, whoever that is in a company. We're trying to create internal alignment within the company. So they form a benefits committee. They know what questions to ask. They know how to put themselves on a path, measure where they've been, figure out a path forward, and then also create that external alignment, which is the person they're hiring to join that team with them successfully to actually get good outcomes. So kind of all sides of it. The documentary is not me. It's everybody else. It's attorneys and CFOs and healthcare executives and HR departments and physicians and practice owners. Super proud of it. So definitely check that out.
Beautiful. I've never met a person that went into HR that is like classically trained in human resources that was capable of managing an insurance policy for 200 people. That is an insurance expert, not an HR emotional hiring, firing, the kind of emotional intelligence person that's out there, but that's the job that it falls in. How do you think AI over the next 2 years is going to help us with all of this muck that we currently have? What is your guess on how does AI help the healthcare industry, or is it just filled with so much bureaucracy that they're not going to even let it in?
Yeah. So I'll break that into two parts. I agree that CHRs usually get left with the bulk of this decision-making process, and they shouldn't, because what they don't maybe yet understand is they have fiduciary responsibility to their employees. So with these healthcare lawsuits, it's not just the company being sued, it's the HR person named in the lawsuit. So
How are they
that's a
not
lot of work
protected?
because they have a fiduciary obligation. So healthcare plans are covered under ERISA, just like 401ks. So retirement and health and welfare plans are all covered under ERISA. So
I'll bet
they
you a lot of
make,
the people don't know that. I
no,
did
they
not
don't.
realize that the HR manager had the same kind of liability that the CFO has.
They do. Yeah.
They could
Anytime,
actually
like,
they pierce the veil.
yeah, yeah. So in these healthcare lawsuits, not only are you seeing HR, but like former head of HR, former operations. So like depending on how the benefits committee was formed at that particular company, it could be any position. If you have discretion over plan choices, congratulations, you are now a plan fiduciary for your company. And this is something I've been teaching for 3 years at conferences all across the country, a lot of SHRM events and CFO events and whatnot. So to the HR point, they absolutely shouldn't be doing it alone because it's too big of a decision. It's kind of my side of the table's fault that that has happened because the brokers have taught companies, have tried to teach companies anyway, that the depth of the decision-making process is there are 4 carriers, choose the least worst of the 4. But that is not true. That is not how it works at all. There are a lot more decisions to make. Those 4 choices that get presented to you year after year after year is more a product of the incentivization on the back end to the broker, right? That's what's expedient to sell, and that's what pays well and is less work. It's not how it works. As far as AI, I don't think there's going to be a whole lot in the healthcare space when we're talking about human resources AI. I do create some tools for my clients. If you think of like a healthcare plan, all the rules and eligibility, and then you have like disability programs and they have different eligibility and age outs and domestic partners and spouses and kids, like there's all kinds of stuff that can kind of drive you crazy. And if you were to aggregate all those documents together, you got 1,200 pages, if you're taking your short term and your long term, your dental, your vision, your health insurance, all these. So what I actually do is I actually create an AI notebook for them where I've loaded all these contracts and all the particulars into them. And then if they have a question and they're like, does our short-term disability allow domestic partners? They can just type it in there and they can kind of get that answer on the fly to their policies, right?
Are they going to be
And
able
so
to
that's it.
later be able to the stuff that you're talking about, the MRI stuff? You think later they're going to be able to ask that question, like, what's the cheapest way I can get an MRI for my policy?
Yeah, for sure. So there's definitely like some healthcare navigation tools that we use for apps. I wouldn't say there's so much AI in that yet. It kind of depends. But yeah, those would probably be the two biggest uses coming up.
Yeah, I'm really concerned about this whole HR piercing the veil stuff. How does an HR employee, if you're out there and you own a business, you're liable if you're providing healthcare insurance, potentially liable. I don't know. Um, how can I remove that risk at least as much as possible for myself? We do business every day, and we're like, hey, I'm protected as long as I don't knowingly do something illegal. I'm protected by the corporate veil. But you're saying that for lawsuits, I might not be protected if I'm the HR and I'm issuing health insurance. So how can I mitigate my risk as an employee for a company when I'm in that role? Because that's dangerous.
It's crazy. It is. The safety and security that a lot of companies feel is I have a big benefits broker or I have a big insurance carrier. Guess what? So did Johnson Johnson, JP Morgan, Wells Fargo. Didn't protect them, right? Like they had the biggest broker in the country. They had one of the top carriers, right? But still, it's about like how they went about making their decisions. So there's 2 ways companies can protect themselves. And the first one is creating that internal alignment. So we create UK plans. This is standard practice now, right? They have a committee, a charter for how they're going to make decisions. They document minutes. They go through their decision-making process. They make sure they have compensation disclosures and conflicts of interest of everybody that they paid within the healthcare plan. So that's a part of retirement plans, and that came as a result of litigation. Same thing should exist in healthcare plan decisions. We're playing with bigger dollars, bigger consequences for both the company and the employees. So that's something we do. And we call that the Ethos Fiduciary Framework, where we're helping companies internally create that committee, the charter, the meeting minutes, the decision-making process, the benchmarks, vetting the proposals, why or why not they didn't go a certain way, right? And like having that and showing that, hey, I checked out all these resources. It's not always like you had to pick the cheapest one, right? But like you're learning, you're educating. You can't be a Johnson & Johnson overpaying for drugs when little companies are doing better than you, right? The second thing to actually just protect themselves is, get E&O insurance, errors and omission, directors and officers insurance, D&O. So that can help take some of the financial risk off. Doesn't mean that you won't be party to a lawsuit, right? So
Correct.
you could still have to defend.
I've come to the conclusion that having a large D&O, E&O, directors and officers, errors and omissions policy, having a large insurance policy in those makes you a target for lawsuits.
Yeah, potentially. I hate the answer of get E&O and D&O because fundamentally I hate any answer. And this is what the insurance industry does is the answer to insurance is more insurance. And I hate that. And that's how like captives and consortiums have started. You're buying insurance for the insurance renewal. Like same thing with this, like you have risk on the way you're making health insurance decisions. Therefore you should buy insurance. Like I hate that. But I will say those policies are cheap, especially when you're looking at it in comparison to the cost of a healthcare plan. So it is inexpensive. It's at least good protections. I wouldn't go crazy and pick the biggest policy to your point, but I would pick a fair amount, at least have some type of coverage. It's not really something your employees are going to know if you have or if you don't have, to be honest. So if they get to the point where they found out that there is a D&O or E&O policy, there's already litigations.
Yeah, that's a lawyer play, not an employee play.
Yeah.
So I was foolish enough one point in my life, Donovan, to run for city government. And when you do that, they send you to ethics class. Like, and you got to go before you can even run and get your name on the ballot. You got to go to these ethics classes. And one thing that they taught us in those ethics class was methodical note taking. Why did I make this decision versus this decision? And have the minutes and have the people on the team sign off on it. Right. This is not something that they have to prove that you you didn't intentionally give them a bad plan, but neglect is a real thing. And if you're just taking if you're consistently everything that comes across your desk, you're checking off the lowest cost thing and you're not having meetings and you're not actually discussing it, that is neglecting your employees. Right.
Yes.
And I find it wild that out of all the meetings that I'm in, PCI, security, HR, all these things, like my monthly security team meeting is probably my most in-depth note-taking one. And the medical insurance one is always just like a 1 hour. We'll pick that one. There's really no notes or anything like that. And I promise you, after talking with you, I'm changing that policy. We will have notes. We will meet probably quarterly on our medical insurance and take meeting notes on that just for risk mitigation for the companies. Right?
Yeah, you're exactly right. Under ERISA, they call that, prudence. So the lack of prudence in the decision-making process makes you liable and complicit, right? Like if you hired a broker that gets paid as a percentage, meaning, they get paid more as your costs go up and your costs have gone up 15% a year, you've never gone back to benchmark on how bad it's been going. You have an employee that's dealt with that for 5 years. Like, yeah, they absolutely have a case on their hands.
And evidence has never been cheaper to create now, right? Like just hit record on your phone.
Yeah.
And put that in a folder somewhere with your documents when you sign them, right? And then you have your evidence. It's just so easy to create.
Yeah. I think it's two parts. So certainly documenting meeting minutes is easy with AI note takers. Like I have an AI note taker in every single meeting I do, no matter what. But the other thing is making sure they understand the process, because unfortunately, I've met very large companies that think their choice is, like I said, least worst of the four, right? And they look at the same four every year and they're like, okay, we did it again. Congratulations. See you guys next year on this decision. But they need to look at it back to that thought process that we talked about of 18 claims per insured employee per year. And then think of that's how many decisions are being made throughout the year, right? So they need to vet this with a little bit more prudence to say, well, what about our drug costs? Like, what about these top 10 drugs? Like, what can be done
Yeah,
here?
we're
What
not talking
about
about that stuff at
this
all.
hospital? Like, can we offer some solutions? That seems really expensive for imaging and blood work and generic drugs. And, it's way more in depth, and they need to look at it. I mean, to the 18 claims per insured employee, there is no other department in the company that has a larger accounts payable than the healthcare plan. They just don't know it or look at it, right? Like there's nowhere else you're going to see that many invoices. So it's just this wild thing that's gone unchecked, unnoticed, because unfortunately, I said my side of the industry has been able to just present it in a different way, not
And the
be
people are scared.
transparent.
And the people
Yeah.
are scared, right? They don't want to deal with it. They're terrified. I get cancer. I want to know that I'm safe. And they're probably
Yep.
not. It's horrible, but it is what it is.
Yep.
Donovan, one last question about insurance and the big companies. If I'm new in HR and how far out before my renewal before I need to start talking about this?
So for us, if we're talking, 200 to 1,000, usually 120 days. Anything more than that, 150 days. And that is not the industry norm. I mean, most companies are hearing from their broker at like 60 days. And the problem with that is like, you get that, it's more, then you get them to go back and you're talking to your team and their team. And then you get forced into a decision because you got to get all the employees together and do it. Like it's that a time crunch is the worst thing. And that's certainly part of prudence, right? Like we know when this time is coming next year. So that needs to be part of the deal. Fine, we're renewing with you. Next year, I want to see my renewal at 120 days, not 60 days. That way we have time to kind of make better decisions and go through a better process.
Yeah, I love it. It's 120 to 150 days. I think that's about right. I had to release my last broker last year because it was this constant showing up late. We didn't have enough time to really renew. So we just had to keep the same plan that we were on the year before. We really didn't have a whole lot of
Welcome to the industry. You are officially in it because that is the experience.
Yeah.
That is what people get, unfortunately.
I like my new broker. He's reasonable and I know where he lives, so I can get back to his house. Donovan, I've had a great time talking about insurance, which was an unlikely scenario. Thank you so much for your time today. I appreciate it. And it's come to the time of the show. If somebody wants to work with you and so they have more than 200 employees, how do they get started? Where do they go? Who is that company person that is going to really you're going to help them get the wheels off the cart or wheels on the cart and get moving in this very, very challenging landscape?
Yeah. I mean, I'd say it's different. I've even had like actual employees go watch the documentary and then get it to their executive teams, and their executive teams got a hold of me. And then we were able to kind of work together and do some good things. So if you're part of that committee or decision-making process, get it to your team, reach out to me on LinkedIn, let's have a conversation, kind of look at it and see what ideas we can do to actually make some improvements in healthcare for once.
Beautiful. I absolutely love it. And we'll throw your LinkedIn link down at the bottom of the screen. Donovan, my favorite show is The Diary of a CEO. And Steven asked all of his interviewees to write a question for the next guest. And I bought the deck of cards. Are you ready for your question?
No, but I'll figure it out.
This is not my favorite figure in the world. Alex Hormozi. The person is the question is who wrote the question. It's Alex Hormozi's question. The person you cherished most in life dies tomorrow. You have 60-second phone call with them. What do you tell them?
Shit, that's awful.
He's not he's obviously done very well in life, but I don't agree with him on a lot of things.
So you're talking to the person you cherish most. God, I mean, I feel like the only thing you'd almost have just like an overwhelming fear of regret of not having enough time and quality time and commitment with like that person to just focus on them. But so they're gonna die. I don't know. I guess you'd want them to not feel alone. That's brutal, man.
I'll go ahead and answer it real quick.
Yeah, let's hear it.
I would let them know that it's going to be okay, and then I'm here for them, and just give them time to say whatever they wanted to say, and just let each other breathe. It'll be okay.
I'd agree. I think they'd want to just feel not alone in it.
Yeah. Just be there with them.
It's heavy.
Alex, that's a horrible question. Get better questions, buddy. Thank you very much.
Wow.
If you're watching the show and you want to answer the question, throw that in the comments. We'd love to hear what you would have to say to your loved one if you only had 60 seconds left. Talk with them. I think it's just to hold their hand and be there with them. Donovan, thank you so much for your time today. I appreciate you.
Thanks, Ken.